My friend called me and said that his wife is having severe tummy ache and vomited 2 to 3 times. And I said that get an ultrasound scan done, it could be gallstone. But alas, no, it wasn't gallstone. But then what else can it be? And then I asked, any surgery in the past? And he said, yes, she had a surgery and there is a hernia there. And then when we examine and we find that the hernia has got obstructed, and when we operated, the intestine had got gangrenous and black, and we had to resect the intestine and stitch. Yes, you guessed it correct. Today we are going to discuss incisional hernia and its risk and treatment. Hi, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital, Kasba, Kolkata. So what exactly is incisional hernia? Our abdominal wall holds all the contents, the omentum, the fat, the intestine, the colon, liver, kidney, inside the abdominal cavity. Now, when we do a surgery, which is either open or laparoscopic, if these muscle layers don't heal properly, then that area causes a bulge over there, and that's called an incisional hernia, because the bulge or the hernia takes place through the incision. Just to quote a statistics, about 15 to 20% of people undergoing abdominal surgery may end up developing an incisional hernia. Now, first we would want to know that what are the symptoms, or how will the patient know that after the surgery things have gone wrong and has developed a hernia. Number one, it's very obvious. Wherever the scar or the incision has been made, in that area there will be a bulge, and it will show more or a bigger bulge on coughing, straining, lifting heavy weight. The person will also experience some kind of a burning and discomfort and pain around that area of the hernial site. The patient may get a feel of bowel alteration, a possibility of a constipation, or sometimes diarrhea. There is also sometimes the patient can present with its complication, which means if this hernia gets obstructed, the intestine, then the patient will come with vomiting. So after the operation, how long a person should be careful after any abdominal surgery? The saying goes, the healing actually continues to take place for nearly up to an year, because collagen gets laid on that, and the strength of the scar or the wound actually continues for about 1 year. Now, majority of the cases, the hernia starts within 3 to 6 months, sometimes a little before or a later after that period. The hernia can be of two types. The incisional hernia. It could be either reducible, when the patient lies down, it goes inside, or with manipulation of the hand, you can reduce inside, or it can become irreducible. When a large hernia, the intestinal content or the omentum comes out and gets adherent to the sac wall, it does not go inside, and that's called irreducible hernia. What matters is how big is the defect or the opening. Now, if the opening defect is not very large, but the hernia has grown bigger, which means the large amount of intestine has come outside, it can get very tight around the opening of the hernial sac, and that's when the intestine get obstructed. And if there is an obstructed hernia, then the intestinal content can't move, and the person starts vomiting, throwing up, pain. And if this obstruction is not relieved immediately, blood supply to the intestine is damaged, and that's when it is called strangulation, in which case the gut becomes gangrenous, and at that time the gut has to be excised and again joined back. So we understand one thing is, if after a surgery a person has developed hernia and symptomatic and getting problem with it, please don't ignore it. We need treatment to fix that. So first let's try and understand what are the reasons why after surgery in abdomen and stitching, why should it form hernia? Now there are certain predisposing causes. Number one, before it has healed properly, which means sometimes it may take 3 to 6 months and even up to a year. If you have put more pressure, which means if you are a smoker, if you have got chronic obstructive pulmonary disease and you're coughing and it's causing pressure on the stitches, if you are constipated, if you are straining, if you are trying to lift heavy weight, so any pressure which comes on your tummy will put pressure on the healing and it may give up. Or if a lady becomes pregnant before fully healed, so that enlargement of the uterus will cause pressure on the stitches. If after surgery the wound gets infected, then the healing is not good, and that's why some of the people can get hernia if the surgical scar gets infected. If there is any inherent defect in the healing or immunity, which is one is diabetes, one is jaundice, and if the patient has got cancer, or if the patient on immunosuppressive any therapy, then the healing is not good and there is a higher chance. I'll give you an example. I was very nicely, one analogy was given. If I stitch a shirt, over there stitches are there. What are the reasons why the stitch will open up? Number one, if the cloth material is not good, if the stitching thread has not been good, if after the stitching there has been too much of pressure, if I'm holding the bus handle and somebody holds the shirt and pulls it like this, it may open. And last but not the least, if the tailor has not been good, his technique of suturing has not been good. So let's put this into our human body. What about the cloth? If the person's abdominal wall muscles are thin, a lady after repeated pregnancy, an elderly lady, the abdominal muscle has got no strength. If the suture material used to repair the abdomen has been an absorbable material or not of proper strength. Number three, as I said, if there has been pressure on it, which we discussed, cough, constipation, weightlifting, going back to work much earlier than your rest period. And last, if the tailor, if the surgical technique, if the repair technique has not been good. Sometimes people ask that after laparoscopic surgery, that hole in the navel, why it causes hernia. In an obese lady, if the depth of the sheath is so low down and if the sheath has not been closed properly, one may develop a hernia at the umbilical area. So now we have understood what are the reasons why hernia take place. Now we have understood that what are the precautions that we must take after a hernia. Well, now that we have accepted that after the surgery hernia has developed, now what should be done? No, there is no medicine, there is no medical treatment. If the area has given way, it has to be fixed. So surgery is the only option. Before surgery, the usual investigation has to be done, which is for a general anesthesia or spinal anesthesia. And one ultrasound or a CT scan can be done to see the size of the gap and the contents. So this gives us an idea how big is the hernial opening. Since I said that the surgery is the only option, there are two ways of repairing. One is open hernia repair with a mesh. In this case, what we do is we excise the excess amount of skin, we open the sac, we reduce all the contents inside, and the sheath, which is the muscles, we bring it together and we stitch it up together and close to each other with a suture material which is non-absorbable, which means it will stay for long for it to heal. And to give it more strength, we put a synthetic mesh on top of that. So this gives us strength on top of the repaired hernia. Nowadays, people say it's mandatory that whatever hernia we repair, we must put in a mesh. So what's the other way of repairing? The other way of repairing is laparoscopic repair, in which case we make an opening and put gas inside the abdomen to blow this, and we put a telescope inside. Once we go in with the telescope, we can see from inside the abdomen the gap, and by putting 2-3 other openings with the instrument, we can bring the two edges of the gap close together and put a mesh from inside and fix the mesh with either a tacker or stitches. Question is, which is better? Now, usually in a small hernia, probably laparoscopic hernia is good enough. But in case if there is a larger hernia, probably mobilization, fixing the gap and open repair is much better. So what's the take-home message that we got from this video? Incisional hernia. It is a non-healing area after a surgery which has caused a gap. It will never get better. So if you keep waiting and hoping, a small hernia will become bigger, and if it gets obstructed or strangulated, it can be life-threatening because the intestine can become gangrenous. And if it becomes too big, there is a condition of giant abdominal hernia, and you must be wondering, what's that? Now, if there is so much of intestine and other content is hanging outside and the two edges of the hernia actually goes on the side, it becomes a large hernia, then it becomes very difficult to put it back again and to stitch it back. I'll give you an example. You have gone on holiday, you have taken a suitcase and you bought too many things and then you push everything, but you can't close the chain. Because if you try to close the chain, the suitcase will burst open. In the same way, here what happens, in a giant hernia, if you just push everything inside and tightly stitch it up, the person will not be able to breathe properly because it will be all stuffed up inside. And the patient usually goes into respiratory problem, patient go into ventilator. So please, when you have a hernia after a surgery, please get in touch with us. If you want further information, get in touch in Genesis Hospital in the following number. And if you like this video, please like, share, subscribe, let everybody know, and keep watching more such interesting and important YouTube videos on health, education, and food and beverage, which we will keep showing you.